So we see the UC diagnosis here, and then what's the next entry you've placed in your chart, Doctor?
Well, after about a little more than a year and a half off, she gets a third course of Accutane for a couple of months.
Okay, so Cammie's got ulcerative colitis, and then she gets this third course of Accutane.
Right, after having been diagnosed with ulcerative colitis.
Okay. And let's see the next entry, Doctor, that you have. You've indicated here on your chart, after 12/2000, back pain, conjunctivitis, and nosebleeds. Would you tell the jury why you placed that entry on your chart and the significance of any of what that means?
Well, nosebleeds sometimes occur with Accutane because the membrane, remember we talked about drying of the mucous membranes, and we saw before that LaRoche says that it's reasonable to assume that what happens up here is the same thing that may happen in the intestine. But what she's having here is back pain and conjunctivitis, and these are extraintestinal manifestations of ulcerative colitis. I can't prove that this back pain and this conjunctivitis are not from something else, but they are occurring in a patient with ulcerative colitis right at the time that they're starting the third course of Accutane. And we talked a minute ago about this overlap. The same things that happen not just in the gut, but that happen elsewhere in the body on the Accutane, that overlap with what happened when they get the ulcerative colitis. It begins to make a package.
Is this kind of like a step progression, or?
Not yet. Not yet. It's not stepwise yet. It's a recurrence of things that may be extraintestinal manifestations, but we have to wait a little while before the other shoe drops with the colitis.
Okay. Let's go to 119, 1654, second page as your support for this.
Mm-hmm.
It's KPS at 1119, 3782. And you see here what you highlighted. This is the support for your record and your analysis.
Backaches, getting worse, extremely red eyes, and nosebleed from Accutane. I don't know whether whether it means nosebleeds from Accutane or extremely red eyes and nosebleeds from Accutane. But within this 2-month period, on the third course of Accutane, everything's going on: backaches and conjunctivitis and nosebleeds. And she still has her ulcerative colitis. We don't know yet what's going to happen with the colitis itself.
Okay. Let's go back to the Dr. Sachar's chart, Evan, and put up the next entry that Dr. Sachar has placed.
Oh, whoops! There's the other shoe.
And tell the jury what you mean by the other shoe.
Well, I mean, here's the third course. Here's the extraintestinal manifestations. These manifestations overlap between Accutane and her colitis, and then bang, right after this third course, within months of getting these extraintestinal manifestations, there she is with a really bad flare of the ulcerative colitis. I mean, fecal incontinence. I mean, imagine that. She's pooping in her pants. I mean, this is bad stuff.
And Doctor, just for the purposes of the record, exhibit number 36, document number 00240. You see here, 3 weeks ago began having fecal soiling with small amounts of frank blood. And we get into the for Wassa enemas again and what have you. So is this the support for the
Yeah, this is
progressive bill?
right at the beginning of March, within days, really within days of her third course of Accutane.
Okay. So let's go back to Dr. Sachar's chart. And the next entry. And here, doctor, you have shoulder pain. And would you tell the jury the significance it can as it relates to your opinion on this joint pain now in the shoulder?
It might be part of the same package of extraintestinal manifestation. She seems to be susceptible to having joint inflammations from Accutane and seems to be susceptible to having similar joint complications, inflammation from her colitis. It's part of this overlap that informs my opinion.